Hey everyone, how are you all? I am just getting on here just to give you a little update on what's going on with me. So, as you all know, I decided not to do surgery because if there's no cancer present, why do surgery? And it's everyone's personal opinion, but mine is based on family history and medical, with my background in the healthcare industry. So I decided to get a second opinion, and I'm having that on April 24th. And once I meet with the surgeon April 24th, if they are in agreement to do a lumpectomy, I would like to do that. And the reason I would like to have a lumpectomy is because when I sleep on my left side where the cancer was present, in my left lymph nodes and my left breast, I have discomfort in the lymph node area when I sleep on my left side. And this has been going on ever since I started my treatment back in October of 2024. So I sleep on my back to avoid sleeping on my left side. And before I was diagnosed with cancer, I used to always sleep on my left side. I'm left-handed, everything was done on the left. But after being diagnosed with breast cancer, I started sleeping on my back, and I became accustomed to it. But now that I'm back at work physically, I am being active and I'm working the evening shift, working 7 p.m., getting off at 10 p.m., which is just a couple of hours because I'm on modified duty due to my my chemoneuropathy. So I've been restless, and I'm not sleeping in the actual bed. I'm sleeping on the couch because the chemoneuropathy has punished my leg. I should say paralyzed, but my leg is not paralyzed because I'm able to move. But for those of you who understand where I'm coming from, the chemoneuropathy is really, really bad. I can't raise my leg up so high. So I get restless and I turn on my left side so I can fall asleep. So that's the reason why I want a lumpectomy, because I feel like the pain will never go away, because as you all know, the pain that I'm experiencing is from the fluid that's on that side. And I want to have a lumpectomy because I think that will subside the discomfort, because it's not like bad sharp pain. It's more of a dull ache, like if you're sleeping on your arm, that's the type of pain it is. It's not like a pain that's stabbing, but it's just a lot of discomfort, and I notice it and it bothers me because I don't want to be thinking, oh, cancer, it's cancer, so I just want to get those lymph nodes removed that did have cancer if possible. And that's the reason why I'm going for a second opinion next month on the 24th. So I hope all is well and I'm able to get that lumpectomy if it's in God's plan. If not, I'm good with that because I really don't want to have no surgery. I just want to do everything natural. And the other thing, I'm going to be meeting with a integrative medicine on Monday because I want someone to talk to me about herbs and natural holistic things that I can do to avoid getting cancer in the future. Although I've been reading a lot and I know a lot of things and I've been doing a lot of things, eating healthy already, but there's some things that I don't know that they don't talk about, and I want to hear from an integrative medicine perspective. So I'll be meeting with that medical provider on Monday, because every time I would call the oncologist to ask questions, since I'm not currently on a treatment plan or anything, they're busy with other patients, so they're not always able to get back to me unless it's something that is pertaining to some treatment that I'm currently getting, which I'm not on any treatment at this time. So I'm not going to take any blockers. I know my cancer that I had in my breast was estrogen, so they recommended that I take the tamoxifen because it's a blocker, but I don't want to have all those different side effects that some people have encountered, and I don't want to have surgery unless it's medically necessary, or I can have a lumpectomy. So that's just my personal take on all this. But anyway, that's what's going on with me. Meanwhile, I'm just trying to get back to my normal life of doing things and taking it day by day and just being positive. And I just want to continue spreading awareness. And if any of you all have any questions, you want to know anything, or you want to reach out to me, please feel free to. I am very personable and don't have any problems answering your questions. And you all have a wonderful, blessed weekend. I'm looking forward to going back to church tomorrow. So hopefully I don't have any more problems with SVT, which is supraventricular tachycardia of the heart. I did talk about I was going to have a heart ablation. I decided not to have the heart ablation. After speaking with the electrophysiologist, I decided not to have one because he said some of the things that can happen, which is a very slight chance going on a pacemaker. And I don't want to be on a pacemaker. I know it's a slight chance, but I don't want to have to worry about that thought. So I'm 48 years old and I don't want to be on a pacemaker. I don't even want to have to think about it. So I'm just going to have the electrical physiologist just monitor my SVT like if he was my cardiologist, and just give me like medication treatment that I can take to avoid it. But my SVT is triggered by stress related, lack of sleep. That's how my SVT is triggered. And having the chemo still in my system, my body is just subject to all kind of things going out of whack. Even my labs are still showing like I'm on chemotherapy. They're just now starting to get up to the normal numbers that they should be at. But other than that, I'm just looking forward to getting back to normal, living life, getting back out there, traveling and enjoying the things that I enjoy and not being debilitated. So there you have it. I know I kind of like went in a little circle, but I like to make sure that you understand where I'm coming from. So y'all have a great weekend. Bye.